Hello, it's Tuesday, June the 7th. I wanted to talk a little bit about some what I see as misconceptions, and that what we're doing here to treat patients with this condition uh, using antibiotics is suboptimal. You know, it, it violates antimicrobial resistance. It, it it causes patients a lot of side effects depending on which one you use. The penicillins and the cephalosporins are bad about causing diarrhea and yeast infections. The quinolones can cause uh, trouble with joint pain, muscle pain, such that they can't be used in some patients. So it's a suboptimal treatment. Um, and I get that, but when you have a condition, when there's an infection present, and we don't really have a good alternative, this is what we got to do. That's what makes patients feel better, and that's really our first goal. As physicians and in the medical field, people are having trouble. Um, you know, Sometimes symptoms can be improved with chronic bacterial cystitis using anticholinergics, antispasmodics, um, but it doesn't eradicate the problem. You know, it's just treating symptoms. So I get it. I get, I get that antibiotics, using long-term antibiotics to treat this condition, can create problems. But until we bring enough awareness, such that the resources, uh, funding, money, research can be done to determine another way to solve this problem, this is what we got to do. Um, you know, our first goal is to help. I wish we had something. I wish we had something easier, less toxic. You know, Things that I've always thought we could use in for the problem would be something like some type of a uh, physical means, to either alter the urothelium, or a physical means to destroy the bacteria. There could be many physical properties that could be used. Who knows? Strange things like low dose radiation in the bladder to kill the bacteria, uh, ultraviolet light. Ultraviolet light's been used in other bacterial conditions. It's used in wounds. It can also be used for patients with ulcer disease. There were some good studies done using ultraviolet light in the stomach. And as we all know, uh, that's a great corollary condition, uh, ulcer disease of the stomach. There was a time when ulcer disease of the stomach was thought to be a result of pH abnormalities, uh, histamine production, uh, a common it's funny, a common medication used when I can remember when I was in high school and college, when the H2 blockers came out, Tagamet, Pepsid, Zantac. Those are histamine blockers, and there's a lot of talk about histamine with these conditions of interstitial cystitis, bladder bladder overactivity. Uh, I mean, I can think back when I was a resident, when patients would come in with bleeding ulcers. We would do all sorts of crazy things. We would monitor their pH of their gastric secretions. Well, of course it was acidic. That's what the stomach does. Um, and then probably, I don't know, maybe 5 years after I completed my residency, uh, they came out with findings from New Zealand that patients that had ulcer disease actually had bacterial infection in their stomach. And now, ulcer disease is treated with antibiotics. Fortunately, it can be treated rather quickly. Just a few weeks course of antibiotics, and the Helicobacter pylori can be eradicated. Unfortunately, in the bladder, we haven't been so lucky for whatever reason. But those are the things we have to figure out. What can we do to prevent the bacteria from entering into the urothelial cell? And then once they do enter the urothelial cell, what can we do to eradicate them more easily? That's my thoughts for today. Uh, it's going to be a big year for this problem. There's some things happening. We're gonna present some data later this year that's going to show the effect of antibiotics on the condition. When no other medications are used, just antibiotics. I think we're gonna be able to show that there is a cause and an effect using this treatment with antibiotics. Have a good week. We'll check in with you next week. Bye.